Hi, as our final podcast for this week's lesson on aging in Canada, I feel very fortunate to welcome my colleague, Dr. Kate Rossiter, Associate Professor and Chair of the Department of Health Studies, who's going to talk a bit about family caregiving. Kate does some really interesting research on critical theories of the body, disability studies, public health, social determinants of health, and theater and performance studies. But today I've invited her not to talk about any of this amazing research, sorry. But instead to share some of her personal reflections as a family caregiver. So Kate, thanks so much for coming and being willing to open up a bit about what I know is a really difficult situation.
Yeah, you're welcome. You're welcome. I think I often wish that I had more access to other caregivers' experiences. So I'm really happy to make that kind of time and space myself in case it's helpful to others walking the walk. So yeah.
Thank you. Yeah. So this lesson has covered issues facing aging Canadians. It's covered dementia. And now we're at the very final bit of this lesson talking about the challenges facing family caregivers. So I was wondering if we could start off by just sharing a little bit about your journey in this role as a caregiver.
Yeah, so I'm a caregiver for my mom, who was diagnosed with Alzheimer's when she was 67. She started having symptoms when she was 64, 65, which puts her in the kind of early onset dementia territory. So someone who is quite young for the kind of dementia journey. And for me, what that's meant is that I have provided care and support for her at the same time as caring for really little kids. And I share that burden with my brother. And I use the word burden truly and carefully. It's not easy. And I often feel like the literature that is provided, or the kind of resources that are provided for caregivers, wants to shy away from the kind of level of work that caregiving can be, in an effort, I think, to not feel insulting to people who need care. And while I absolutely understand that, I also want to be clear the kind of level, the kind of work that caregiving involves, and the fact that oftentimes that work isn't chosen. It's something you take on because of your kind of role in a family, and it is a burden. It's hard work. Sometimes hard, sometimes very joyless, sometimes very difficult. So just wanted to flag that, because often it says, the kind of literature that I see says, caregiving can be a challenge, but also full of joys. And I often really resent that. Yeah.
I can relate to that feeling.
Yeah.
So tell me a little bit, Kate, if you don't mind, what kind of role do you play in a day-to-day capacity, or a week or month by month capacity? What kind of things do you do to support your mom?
So, that journey, that has changed. My role has changed over time in some ways, although in some ways it's remained pretty fixed. My mom is someone who was diagnosed young and wanted to remain independent. And I think my brother and I have really understood some of our role with her as facilitating as much independence and dignity and autonomy as we possibly can and could have. One of the hardest parts about Alzheimer's is that it really robs the person who has dementia or has Alzheimer's of those abilities. And so I feel like what we are constantly doing is kind of juggling with her and kind of and again, I am mindful of the fact that it's a bit of a kind of no to talk about Alzheimer's alongside talking about, kids and babies and the worry about infantilizing people. But, with my kids, we have adjusted, the kind of level of independence that we give them as they get bigger, and all of our expectations kind of shift as they get bigger and more capable and more able. With my mom, it's the same thing, but in a different direction. That's not a very tangible kind of, that's sort of the kind of umbrella of how we've approached our work. But, the day-to-day involves, and can, depending on where things are at. So for the first many years, the day-to-day involved a lot of kind of checking in with her as she lived independently, making sure that she was okay, making sure that she was safe, taking over her finances, which was really tough, figuring out alternate strategies around transportation, alternate strategies around living, working to secure caregivers for her that she liked and that she trusted, buying her clothes that she could put on and off herself, figuring out strategies to keep her in clothing that felt dignified and comfortable that she could manage herself, figuring out new toileting routines, new living conditions, managing all of her medical appointments. So, it really is helpful to have a person who holds the narrative thread for all of those visits. And I can think of 10, 10 different healthcare providers that I kind of hold for her in my head of all the various different people and specialties and things that she's had done. So holding that narrative and going to appointments with or for her, managing legal decision-making on a daily basis. So making decisions about care. Those fall to my brother and me. And, I think in the last few years, my mom didn't want to live with either of us. And I think ultimately that was a good decision. But we've had to make decisions about transitioning her into different spaces and then managing really for us crisis after crisis. And that's not everyone's experience. I think with dementia, it has been our experience. My mom is someone who has weathered really a lot of crises. And that may be in part because we've worked so hard to kind of keep her independent. Sometimes that independence has backfired. She was, hit by a car before moving into assisted living. And she was okay and the car was fine. Managing, I think, also her own kind of emotional state around losing her life and her sense of dignity and her sense of worth. So there's been a lot of kind of emotional holding that's gone with that. So, for me, the job is varied and really has included being her kind of stable caregiver, the person who's made sure she's safe, the person who's made sure she's emotionally kind of well-tended, as well as the kind of ancillary pieces around like the legal decision-making, the medical decision-making, financial decision-making. Yeah. Some of that we've turned over a little bit more, but yeah. So we've sort of shared that out with now private caregivers who are on the scene a little bit more, but that's added a kind of work in terms of being an employer for multiple private caregivers and managing payroll and managing hours and managing SIN numbers and all those kinds of things. So, the work is really varied, but it is absolutely daily. It is day in, day out. The other way that it looks for my brother is that because we share care, we're in constant contact. So, for every decision, there's usually kind of some discussion about that and discussion about how to manage things with her and going forward. And that's, should we keep her on this med? Should we take her off that med? What about this caregiver? What about that caregiver? What's happening now? What's happening there? So there's also a tremendous amount of just kind of keeping each other in the loop. Yeah.
Wow. That's
I think you're on mute.
Can you hear me now?
Yeah.
Okay. Yeah. I have two questions that arise from what you just said, which is an overwhelming journey just from listening to what you've taken on. The first is, how on earth do you cope juggling this plus being a mom plus being a professor? It sounds like you have 3 jobs on the go.
Yeah, I do. That's a really hard question. It's a hard question for me to answer right now. I didn't expect to get emotional. It's taken an enormous toll on me and my life. Yeah.
Yeah, I think that's,
sorry.
I think that's completely.
Yeah. I have taken on my mom's care out of both obligation and as a labor of love. But I would be not telling you the truth if I didn't say that it hasn't had a profound impact and taken a real toll in terms of my life. Yeah.
Of course. And Kate, what do you think would happen to your mom if you and your brother weren't there? Like, it sounds like you're the glue that's keeping so much together, but not everyone has adult children capable of doing this. So what happens to those who don't?
We ask ourselves that a lot. And I actually don't really know the answer. I think my hope is that that work has generated some times of joy and pleasure in my mom's life that wouldn't have been there. I think that for my mom in specific, and again, this isn't for everyone, but for my mom in specific, I think she would have found herself in much, much more difficult living situations. I think, and this really ties to the work that I do with people with intellectual disabilities, and maybe part of what kind of drives me with my mom's care, is that I do know that when people don't have an extra set of eyes on, or somebody advocating for them fairly consistently, the possibility for really profound forms of violence to occur to that person is really high. So for example, my mom is someone at this point who is quite violent, and again, not everyone with dementia or Alzheimer's doesn't go that way. My mom happens to be someone who has experienced a really high level of distress and fear with her disease, and that's caused her to be to really act out a lot. And she's had to be hospitalized, and in hospital has had to be restrained fairly frequently. And I know from, again, the other parts of my life that, that kind of physical vulnerability is ripe for abuse, is ripe for staff acting out of their own exhaustion, their own overwhelmedness, their own sense of being worn down. And in fact, we have had that. She's a difficult client, she's a difficult patient, and we really have seen the effect. She was pushed by a staff member quite hard earlier in the summer. And, so I know, I don't know that I could give you an answer about what would have happened to her. I know that I have worries about what would have happened and some proof of what even has happened, even though we're very much on the scene with her. So some of it is about quality of life. Some of it is about her safety, her well-being. Some of it is around safeguarding her dignity as much as possible. And I don't really have good answers about what that would have looked like without this level of care. I suspect she would have been in a pretty tough place, given the kind of level of need she has.
Thank you.
We don't do well. I think for me, we don't do well socially by people who have disabilities. And I think it does require a level of pretty profound commitment to care and to allyship as a caregiver. Yeah.
Thanks. You've been so generous with your time. I have one final question.
Yeah.
Since this is a health policy class, do you have any suggestions for policy changes that could better support caregivers like you, so it wouldn't be so burdensome and so difficult?
Hard. Yeah. That's an interesting question. What I've experienced in the last year acutely is the sense that that the systems overlap and they're not clear, and that there are no means of making the system very clear to people who are trying to access it. So trying to work through the LIN system, or what was the former LIN system, to access care inside the community versus in the hospital, it is a labyrinth. And so that's not necessarily a policy change as much as providing caregivers with some sense of clarity about how the systems work, and what to expect from the system, and who the players are within the system. There are some small things like, my mom has been at the hospital and bouncing around the hospital a lot. And we often don't know who we're talking to when people from the hospital call. They don't tell us who they are on the team, or how the teams intersect, or how we might get in touch with people in order to be able to follow up around care. So there's a real kind of system level opacity that I think makes it much harder for people like me to do my job as a caregiver. And again, this isn't necessarily a policy piece, but as much as a kind of overall reframe that I think might help inform policy. Alzheimer's is in particular, and I think this is probably true of other diseases, but Alzheimer's very in particular is a family disease. When my mom got sick, we all got sick with her. And In the same way that I think that hospitals need to understand moms and newborns as dyads that go together and are not separable and are should never be understood as anything other than, a linked pair. Often like I've spent time with my babies in hospital for different reasons, and they would understand my baby as the patient and me as someone separate. And I always wanted to say, like, actually, no, we're not, you were not actually that separate. You wouldn't have understood us as separate, like when I was pregnant 2 weeks ago. I think likewise, understanding patients, the family members and caregivers of patients with Alzheimer's as also having the disease, as also kind of being on that journey and of needing sort of a tremendous level of support from the system. Because they also by extension have Alzheimer's. Their world is upside down. It's very disorienting to have someone you love go from being someone who is coherent with a coherent narrative and a set of abilities to navigate the world to being someone who is not who they used to be at all, and someone who doesn't have the capability to navigate. It is not only it's laborious, but it's also just really disconcerting. I think end of life is hard at the best of times, but end of life, when you don't know who the person you're caring for is anymore, and you can't actually come to rely on them for a set of stable responses in the way that you might have, is really, really difficult. So, I think being mindful of that when we make policy, being mindful of crafting policy that understands families as part of those decisions, as needing a lot of clarity, as needing a lot of needing a high level of support, and again, like an example of the kind of contrariness of that is the new bill to move people out of the hospital. So, my mom will in all likelihood be caught up in that bill. The new bill is to get people like my mom, who is currently in the hospital system, out of the hospital system into long-term care. It may very well be that we have no choice about where she lands, and that will make our lives a whole lot harder. It'll make our lives harder, not just from an emotional perspective, but like from the perspective of actually being able to assist the facility to care for my mom well, if we can't get there, if we can't physically get there very often, we actually can't do our jobs. Caregivers are not ancillary. We're not, sort of a nice frill. Actually, we are the people, my brother and I are the people who hold all the pieces of information about my mom's care. We are her voice. We are the thing that allows her to continue to have a voice in the world. And when we're not able to do that, she becomes totally voiceless. It becomes difficult to care for her, and her care becomes undermined immediately. So, the role of a caregiver ideally is one that is deeply supportive of the care being given in an institutional space or a facility. And so making that harder for caregivers really undermines, I think, the work that, for example, long-term care is doing ideally. So, again, that feels like a real sledgehammer approach to a hard problem, and one that I think may leave people really damaged. Yeah.
Wow, thanks, Kate. You've packed so much in, really important, insightful, and moving information. And I know that this is obviously affecting you personally. And I just want to thank you for opening up and being so candid. And
yeah, you're welcome.
Yeah, thank you.
Yeah, you're very welcome.